Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering those questions and connecting you to resources. If you live with multiple sclerosis and you're unable to work due to an MS-related disability or other condition, you may be entitled to receive Social Security Disability Insurance, commonly referred to as SSDI. The Social Security Administration recognizes MS as a chronic illness or impairment that can cause disability severe enough to prevent an individual from working. But applying for SSDI benefits can be a confusing and frustrating experience. Jamie Hall is back with us today to continue our conversation about how to best navigate the SSDI application process and to explain possible outcome scenarios. Jamie is an attorney specializing in Social Security disability and long-term disability law. Welcome back, Jamie. Thanks for being with us.
Thank you for having me, John. I appreciate you and the Society letting me join again today.
Well, when you were last with us, we reviewed the criteria for applying for SSDI and discussed some of the things someone might want to consider before deciding to leave their job and apply for SSDI benefits. I'm hoping you'll give us a quick review of what SSDI is and how it might benefit someone who's living with MS.
Yeah, so SSDI is a federal disability program, and it's what we typically think of when someone says they're on disability. It's a program that really has two components to it. One program is cash benefits paid monthly to disability applicants. And the second component is Medicare eligibility, which obviously with the number of providers MS patients tend to see is a huge part of the benefit as well. So again, it's a federal disability insurance program, and that program gives you access to both cash benefits as well as to Medicare insurance coverage.
So after someone living with MS has decided to apply for SSDI benefits, what's the first step in the process?
Yeah. So the first step, frankly, is speaking with your family and providers, making sure that they're on board with the application and that your team around you knows what you're getting into. As far as starting a formal application itself, that step would be contacting the Social Security Administration or an attorney's office to assist you with a disability file.
Rose contacted us, and she's wondering what information from her work history is relevant in this process, and how should she prepare that information for her application?
Yeah, so Social Security looks at the work you've done in the past 15 years, because under their disability standard, question number one is, can you do the work you've done in the past 15 years before disability began? So they'll want to know who your employers were, what your job duties were, and things of that nature for those jobs in the past 15 years. So gathering up some of the resume information, dates worked and typical tasks and things like that is really helpful when you start the application process. That being said, Social Security will typically send you out a form that puts all that information on a single document, makes it quite a bit easier to note down there as well.
Rose also told us that she knows she'll need to work with her doctor. But like many people living with MS, Rose has a care team that includes several doctors. So Rose wants to know which of her healthcare professionals she should be working with to complete her application.
Yeah. So generally, whoever's willing to work with you is helpful in that scenario. We find that the doctors who are the most specialized in MS are the most helpful in the statements that they give. But oftentimes it works the opposite direction, that primary care has a better rapport with the individual because they may have seen them longer and more frequently than the neurologist has. So frankly, they should speak to all their providers, whether it's neurology, physical therapy, primary care, psychology, make sure they're on board with the claim and see if they're able to assist them in supporting the disability claim itself. You will never have an issue giving too many supportive opinions to Social Security. So if someone's willing to help, we always take them up on that from medical provider.
What health related documents or medical test results need to be included in the application, and who manages the submission of that information?
It's a good question. So initially, at the initial application, Social Security will request all the records you tell them about on their end. So if you tell them about your neurologist and your primary care, Social Security will put out a request for that documentation. It is on the claimant to make sure that the proper data is there and a full record is there, but they'll at least make that request. It's very different at the hearing stage because if you have to go to a hearing, the burden is on the claimant or the claimant's attorney to gather all those medical records. And frankly, it's one of the major tasks of counsel is gathering and updating all the records and reviewing them and things like that. As far as the data you want to see in there are some tests that are more important than others from a disability perspective. Obviously, an MRI that gives you objective data of what kind of lesion activity there is can be really helpful. 9-hole peg test that assess hand function. 6-minute walk test that assess walking capacity. Neuropsychological evaluations are helpful, as are functional capacity evaluations. Basically, any kind of test that objectively identifies what the person's going through is really helpful in proving to Social Security what's going on.
Carrie tells us she's a little overwhelmed by the amount and variety of items she needs to pull together. She's wondering whether there's a checklist or some other resource available to help keep her organized.
So initially, I would tell Carrie, this process is overwhelming. It is not something you're used to dealing with. It is a different world for most people. It's akin to me taking my car to a mechanic's office. It's not what I do for a living, so it's by definition overwhelming here. But there are certain ways to make it less intimidating and to help you organize these issues on your end. In fact, I was lucky enough to work with the National MS Society a few years ago and developed a guidebook on the Social Security disability claim process. And that guidebook can be found online. Again, National MS Society, it's the guidebook applying for Social Security disability benefits. It's a longer document, but the last few sections of it are tailored solely to get information to assist in a disability claim, such as organizing data on your doctors, on your income, your work history, things like that, that can make that process a lot easier. So that's one example. There's others online as well, but that's one that's kind of close to my heart here and the societies as well.
As I mentioned earlier, the process of applying for SSDI benefits can be frustrating and confusing. Greg tells us that he's already been denied once and wants to put together a stronger application. He's looking at hiring an attorney, but isn't sure what or who to look for. What's the role of an attorney in this process, and how can someone like you help?
So we are guides in the process. The claimant has earned the disability benefit before they walk in the door. The doctors have written the documentation before they walk in the door. As a guide, our job is to take the claimant, educate them on the process, make sure the proper documentation is submitted, and make sure documentation is supplemented with statements where appropriate. But again, our job is to take some of the mystery out of what's going on and also to educate the claimant. If you don't know what the standard for disability is, you can't help us fully develop your claim there. So that's really what a large part of our job is. And as far as what to look for with an attorney is someone you have to build a rapport with, because you are on a journey with this individual that may last 5 to 18 months. You want to be able to speak with them. You want their staff to be able to speak with you. And frankly, you want the attorney and the staff to speak the unique language of MS. If an attorney has a lot of familiarity with this condition, they'll know when you say you're fatigued, it means something different than most people say it. When you say you have gait issues, it means something different. and to be able to talk that language to know what's going on makes a huge difference and allows us to educate the claimant as much as they educate us. And that's really important here.
Greg also told us that he's already stopped working. He doesn't have a lot of financial flexibility to pay an attorney. How do attorneys get paid for assisting with SSDI applications?
Yeah, so the attorney's fees are set by the federal government. So all attorneys charge the exact same rate nationwide for these cases. And the most important part is it's contingent, which means we don't get paid unless and until your claim for benefits is approved. And it does a couple of things. One, it makes us pick good cases and work them hard, because if they're not approved, nobody gets paid at all. And number two, it takes the burden off the applicant who can't currently work from paying an attorney before they're paid, because we don't get paid unless the benefits are paid out and until they're paid out. So nothing comes out of the person's pocket until they're getting money from the SSA itself. So it's actually one of the better systems out there, and the fees are a little bit more modest than you typically see because the government's protective of applicants here.
Well, one of our viewers, Leah, agrees with you. She tells us she thinks an attorney who understands MS is going to be a great benefit in this process. Are there resources available to help Leah find a good attorney who understands and speaks the language of MS?
It's challenging. There's a lot of attorneys out there. There aren't a ton who have a very strong focus in MS. The way that individuals come to me may be a good example here. A lot of them will talk to their neurologist, and their neurologist may suggest they contact my office, or the social worker at the neurologist office may recommend that. Look online, look for things people have written as attorneys about the condition of MS. That often shows they have a focus on that as well. And perhaps most important, just when you speak with the attorney, listen a little bit too. Are they speaking the language of MS? Do they know about your medication, whether it's an infusion or an injectable or whatever it may be? They should have a bit of knowledge there, and that's a good sign as far as that goes as well. Last, many MS patients are part of support groups or things of that nature. Ask others in your support group, because they've been through it, they know firsthand.
Are there other professionals that Leah should consider working with through the application process?
Yeah, so I always say use whatever resources you have available. There are some neurology offices that will have a social worker who can give some limited assistance in filling out paperwork and guidance and things like that. You should always take advantage of that, because that's an invaluable resource and tool. As far as beyond that is concerned, really people are looking at the assistance of family members and things like that, maybe able to help people organize their thoughts or fill out forms or whatever it may be.
Jorge tells us that his father has decided to apply for SSDI benefits, but he isn't a native English speaker, and he's asked Jorge to help with his application. So can Jorge help his dad as a proxy through the SSDI application process?
He can. And this is one of the more difficult things we've seen. And in fact, when my office hired a bilingual assistant just a few months ago, because the Spanish speaking population has real challenges because of how the system's set up and everything. So to be able to provide things in their native tongue is really important there. That being said, whether it's Jorge or whether it's simply someone else's child, a family member can always assist in the application process. Signatures are always done by the claimant. The data is always about the claimant, but others can assist and make that a bit easier, including Jorge in this scenario.
Well, speaking of making it easier, Jorge believes it would be easier for him to submit his father's application online or even by phone, but his father wants to go in person. So are there multiple ways to apply, and what should someone consider before choosing how they're going to proceed?
Yeah, John, there's 3 ways to apply for disability. There is in person, online, or via phone. Each one has its own pros and cons to it. My office always files applications online. We do that in large part because if you file online, you control exactly what data is being given to the SSA, because you're literally typing it in. And number 2, you can pause it whenever you want to and come back to the application process at your leisure. So if you're fatigued and let you do 20 minutes at a time, you can break it up over several days. It's a really nice tool to have. If you go in person or you file it via telephone, you are to an extent reliant upon the quality of application generated by the person you're meeting with at the SSA as far as your claim goes. So if they are overworked or new at the position or something like that, your application may not reflect as strongly as you'd like it to, which again is on my office for 15 years, has filed every application online. We just think it's a more polished way to do it and everything.
Do all these methods take about the same amount of time when it comes to processing that approval, or is there any way to expedite the application process?
So there generally aren't ways to expedite the process, especially at the initial level. At the initial level, I honestly believe the SSA is typically doing things as fast as they can with the limited staff they have. At the hearing level, there's some limited ways to expedite an application, but that's typically because a person has become homeless or something of that nature. So alleging that you should have a faster process because you're really disabled, not just kind of disabled, isn't really going to be an effective argument. It's something that's much more dramatic than that. Again, typically something like loss of home or something of that nature.
I know there are very specific eligibility requirements about what constitutes disability in order to be approved to receive SSDI benefits. Now, Larry has been on SSDI for almost a year after his optic neuritis caused him to stop working. But with treatment and medication, Larry says his vision has improved. Does this improvement retroactively change his eligibility to receive benefits?
So it does not. If you're disabled for a given month, you're disabled for that month, and later improvement doesn't change that eligibility that you had at that time. And again, the Social Security wants you to improve. They want you to get off the disability rolls and get back to work and everything. And we see it from time to time, not necessarily with MS, but with other conditions where a surgery or a new medication does help people get back in the workforce. The SSA is very careful not to punish people in that scenario and to let them keep the benefits that they have truly earned by their limitations during the months when they could not work. So in this scenario, he would not pay back any of those benefits. He would lose eligibility going forward, but he wouldn't lose his past benefit.
Christina was recently approved to receive benefits. Now she's worried that the approval might be reversed sometime in the future. So is there anything that could happen to reverse that approval that we haven't already discussed?
So Social Security will periodically review approved claims. It's not done very often, typically every 3 to 5 years. And it's typically a very, very basic review process. I tell my clients typically if you are still treating and still symptomatic and you respond to the request for information, you're going to stay on benefits 99 times out of 100. In fact, in my over a decade of doing this for hundreds, if not thousands of MS patients, I've not once had a client thrown off who was approved who didn't go back to work. But you have to respond to their inquiry and you have to be treating. People who get thrown off are typically people who have some psychological issues, who choose not to respond to the request for data. But as long as you're responsive and still treating and still symptomatic, it's not a big concern. You just have to respond.
Well, you've shared some really helpful insights about navigating the application process to receive Social Security disability insurance. What would you say are the top 3 takeaways that you'd like our viewers to remember?
Yeah, so number one, we talk about team in my office quite a bit. And the team is the claimant, it is my office for our clients, and it's also the medical providers. And like any other team, you want to keep them in the loop and let them know what's going on. So with your medical providers, let them know if a disability claim is going to be coming in the near future. Oftentimes doctors will write a little bit different note or clarify things. Letting the doctors know that a disability claim is coming and one's been filed is really helpful to get everyone on the same page. Number 2, as we talked about, the process can be confusing. It's simply part of doing something that's foreign to you. Don't let it overwhelm you. Don't think it's just you. It can be. And that's why you have a support network. You have family, you have friends, you have counsel, your doctors. We're here to help and make things a bit easier for you. Finally, and I can't stress this enough, denials happen in the disability process. That's why appeals exist. Many, many claims that are very well supported and very well documented have to go to a hearing. Don't let a denial push you from the process here. That's why appeals are there. Appeal it and get it corrected there.
Well, thank you for sharing your expertise with us, Jamie. I think we have time to answer a couple of more questions, and I have a question for you. If someone has previously been denied SSDI benefits, is there a limit to how many times that person can reapply?
So there's not a limit to how many, but there's a limit to how long you can be out of work and qualify for disability at the initial level. So typically, you have to show your disability began no less than 5 years after leaving work. So if you keep filing and getting denied and 6, 7, 8 years have passed, you probably can't qualify anymore. But for those first 5 years after leaving work, in many scenarios, you can file a new claim if you're denied and essentially get a second bite at the apple there.
We heard from Duke. He's wondering what other state or federal programs that he might be eligible for if he's approved to receive SSDI benefits.
Yeah, so it varies by the state quite a bit there. We talked on a prior sister podcast here about SSI. That's another program out there that may qualify in some limited scenarios. There are also some states that may have eligibility for state-based disability insurance. California, which you know well, New Jersey come to mind immediately, and New York State, as states that have state-based disability coverage as well. So you should look at your state for possible coverage in addition to the Social Security benefit.
Well, I want to thank everyone who submitted some great questions, and thank you, Jamie, for being with us today.
Thank you, John, and thank you to the MS Society for having me here today.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like MS Friends and self-help groups. You'll hear about ways that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Jamie for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and on YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback to today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Jamie Hall and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.